Preventive health. Know the signs of bladder pain, the 4 causes. The following information, provided by Diana Rodriguez. Restoratively reviewed by Casey Church, MD, reviewed July 16, 2021. And www.healthcaresolutionsteamsarasota.com. Know the signs of bladder pain, the 4 causes. For ladies experiencing bladder torment, a contamination is regularly default. However, it is by all account, not the only purpose. Bladder torment can flag anything from a minor disease to a genuine medical issue like malignancy. Indications might go from uneasiness in the lower midsection region to igniting with pee. Fortunately, bladder malignancy is uncommon, and bladder torment is typically not genuine. Yet, that doesn't mean you ought to disregard it when you have torment or pressing factor in your pelvis or lower midsection that might be coming from your bladder. How would you know whether the aggravation is troubling or shows a harmless condition? Focus on different side effects you have, especially on the off chance that you have blood in your pee alongside bladder torment, says Nazima Y. Siddiqui, MD, an academic partner of obstetrics and gynecology at the Duke University School of Medicine in Durham, North Carolina. Bladder agony could be because of the conditions recorded beneath. Yet, torment in the bladder region can be brought about by pelvic torment because of gynecologic conditions. Certain gastrointestinal issues can likewise prompt agony in or around the bladder. At the point when ladies have bladder torment, they should look for assessment, Dr. Siddiqui says. 1. Urinary tract infections, UTIs more common in women. Urinary plot diseases, here and they're called bladder contaminations, strike ladies more frequently than men, and straightforward life structures is the reason. The female urethra is nearer to regions that have normal microbes, like the rear end and vagina. It's likewise more limited than a man's urethra, as per the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. Bladder torment from UTIs can occur at whatever stage in life. In young ladies, it is a generally expected side effect of urinary lot contaminations, alongside successive and excruciating pee. Side effects in more seasoned ladies can change, yet ordinarily incorporate muscle hurts, stomach agony, weariness, and shortcoming. See your PCP since treatment with anti-infection agents like macrobid, nitrofurantoin, or Bactrim, trimethoprim, sulfamethoxazole can typically clear up a urinary plot disease, the NIDDK notes. What's more, however, the disease might disappear without treatment. Antimicrobials can speed mending and rapidly dispose of awkward side effects. Drinking additional liquids and peeing oftentimes will likewise assist with treating the contamination and your inconvenience. 2. Interstitial cystitis, a severe form of bladder pain syndrome. Multiple million American ladies live with pelvic agony, identified with interstitial cystitis, a condition wherein the bladder divider becomes aggravated and kindled, as indicated by the NIDDK. Interstitial cystitis is a serious type of bladder torment condition, Siddiqui says. Bladder uneasiness from interstitial cystitis might go from delicacy to extreme agony, as per the organization. Another piece of information that interstitial cystitis is the guilty party. Menstruation will in general deteriorate bladder torment. Interstitial cystitis isn't brought about by a urinary parcel disease, albeit the manifestations might decline in the event that you have interstitial cystitis and get a UTI. While the reason isn't perceived, as indicated by the NIDDK, certain occasions or factors appear to trigger flares in side effects. These incorporate pressure, changes in diet, sensitivities, and ingesting certain medications, in addition to other things. Treatment alternatives for interstitial cystitis incorporate distending, extending the bladder, taking oral medicine, active recuperation, and utilizing electrical nerve incitement to reduce torment, yet there is no known fix. In extreme cases, where different medicines haven't worked, some of the time a medical procedure is a choice. 3. Changes in your reproductive system. Bladder torment in ladies may likewise be an aftereffect of diminishing vaginal skin, says Carl Luber, MD, a urogynecologist and an originator of the Female Pelvic Medication and Reconstructive Medical Procedure Association program at UCSD, Kaiser Permanente, in San Diego. This is called decay, and it's most normal when menopause denies the tissues encompassing the vagina of estrogen, he clarifies. Oral estrogen doesn't help, however, a vaginal estrogen cream might ease indications. Talking with your primary care physician about bladder torment and inconvenience can assist with figuring out where the issue truly lies, Dr. Luber says. 4. Bladder cancer, less common in women. Bladder malignancy is uncommon, particularly in ladies. Of the approximately 83,730 new findings every year in the United States, around 19,450 are in ladies, as per the American Cancer Society, ACS. The most well-known indication is blood in the pee. A few ladies additionally experience an excruciating, consuming sensation while peeing. Bladder malignancy therapies incorporate a medical procedure, chemotherapy, and radiation treatment. As per the ACS, a great many people need a medical procedure to eliminate a cancer or growths. All or portions of the bladder are eliminated in serious cases. Get a diagnosis, not a self-diagnosis. Consider whether the uterus and different organs of the gynecological framework could be causing bladder torment, Siddiqui says, as they are near the bladder. Pelvic floor brokenness, like snugness or fits of the pelvic muscles, regularly happens with bladder torment and may aggravate bladder, she clarifies. Pelvic agony can likewise be brought about by endometriosis, pelvic incendiary infection, or ovarian sores. Furthermore, gastrointestinal issues, like fiery inside illnesses, known as Crohn's sickness or ulcerative colitis, can now and again be the wellspring of pelvic agony, notes Mayo Clinic. On the off chance that none of these conditions are available and ladies have continuous bladder torment, they are commonly treated for bladder torment disorder, which alludes to excruciating states of the bladder, where different causes, for example, UTI and disease, have been barred, says Siddiqui. The main concern for ladies to remember: don't self-analyze your bladder torment. Tending to and treating the issue can offer alleviation for body and brain. Have an awesome, beautiful, beachy kind of blessed day, in your heart and attitude, always.